Overseeing prescriptions for the nearly 2,000 patients at Bluffton Jasper County Volunteers in Medicine is challenging enough. Adding to the challenge, counting, ordering, distributing, and keeping track of all of those medications by hand without a specialized pharmacy computer and with a volunteer pharmacist who is only in-house 4 hours a week.
We are operating like I used to operate 50 years ago. We are operating with pencil and paper. The computer system would allow us to know our inventory at any moment.
Right now, it is largely left to the nurses, who are not pharmacists, to fill prescriptions.
Having a new program would eliminate a lot of time that I spend in the pharmacy, as well as the nurses.
And once a nurse fills that prescription, they must find a doctor to sign off on the label before it can be given to the patient.
If the pharmacist fills the prescription, it can be handed out to the patient. But if a nurse fills the prescription, a doctor has to sign the label.
Nurses too often have to do hours of paperwork over the weekend to keep the pharmacy compliant with state regulations, and they're often pulled away from their actual nursing duties while at the office.
Because our volume has increased so much, our nurses are spending more time here in the pharmacy when they really need to be with the patients.
With the community foundation of the Low Country Impact Grant, Volunteers in Medicine could hire a part-time pharmacist, which would make the process of filling prescriptions and refills much easier. Even having a pharmacist just 3 days a week would make a huge difference.
3 days a week would allow refills to be picked up 5 days a week without a physician having to be involved.
The grant would also be used to install a pharmacy computer system that easily keeps track of medications, orders, and inventory. A specialized pharmacy computer also has a built-in safety net to ensure the drugs being prescribed work well with the patient's treatment plan.
It will keep a day-to-day track of how many drugs should be on the shelf. It'll also give us drug interactions. It'll also give us allergies for the patient that we will not have or we don't have at the present time. It's really a must.
And this program will allow us to scan the drugs and then automatically put them into a spreadsheet, so we're able to have a better control of our inventory.
The Impact Grant would allow Volunteers in Medicine to double or triple its pharmacy inventory, while potentially reducing costs.
What used to cost us $10,000 is now costing us almost $23,000. So being able to expand into the direct relief will allow us to expand our pharmacy and hopefully reduce some of our pharmacy costs.
Our main focus here is preventative care, and I would say at least 90% of the patients who come to us actually require a medication to help them with existing illnesses or transient illnesses that we discover. And if we weren't able to give them some immediate gratification by actually giving them a solution to the problem, by grabbing some medication and explaining how it's going to help them, we would lose a lot of the oomph that we like to have with our first initial encounters with the patients. Plus, they learn to rely on the fact that we're going to continue to do something like this. And that really builds trust between the patient and the provider.
We want our patients to be able to come to the clinic and receive what they need here, rather than having to go out into the community and use their money that they might need for food or for rent.
Once they know that medication A is working, they need a steady stream of that medication. So it makes both the patient and the providers a lot happier if we have a fairly generous formulary and that we can choose the right medicines.
Having the right medication available and enough of it is extremely important, particularly for patients with diabetes.
Having the same type of insulin each time is absolutely critical. Insulin is not affordable. There is not an inexpensive plan at Walmart for insulin. So I think of all the things we have here, the insulin is probably the most important.
The Community Foundation for the Low Country and Belfair Foundation have been instrumental in taking Volunteers in Medicine's pharmacy from a closet with 4 bottles of medicine to what it is today. But with its increasing number of patients, Volunteers in Medicine is in desperate need of a pharmacist, a pharmacy computer, and a larger inventory of medication.
6 years ago, we split this door so that the pharmacist would be here and our patient would be on the outside. And it's been our dream to be able to have a pharmacist that can actually do that and help educate our patients. So this is taking the clinic to an all new level. We have grown so much and we're continuing to grow.
So an automated, fully staffed pharmacy would be a wonderful thing.
It would improve the safety for the patients, and it would make life easier for both doctors and nurses.